and I'd like to welcome you all tonight to our SJT event. This is the first time the MSA has put on an event like this, and so therefore we'd really like your feedback. It might be good, hopefully it will. So yeah, your feedback's really important, so we know whether or not this is helpful and whether to run it next year and what we can improve on. So you should all hopefully have a feedback form, which should be circling around. If you put your hand up if you don't have one. Okay, where are the feedback forms? Does someone have a pile of them? No. Okay, I'll print you some more and give them to you. Bring them down the front. I'm aware some of you have handouts, some don't, but don't worry, this lecture is being recorded, it's being videoed, it's being put online, and you'll have your handouts online as well, and they'll be emailed to you. So I think you have enough opportunities to get the slides, that should be okay. So then all that's left is for me to hand over to our F1, who has taken this exam last year, Dr. Nikhil Ahluwalia.
Good evening, everyone. So my name is Nikhil. I'm an F1 at Tunbridge Wells in South Thames at the moment. But more importantly for this presentation, last year I was a fifth-year medical student here at King's, and so that means 12 months ago I was sat where you all were worried about this SJT exam, which is, well, to me at least, it was pretty worrying because I had no real idea of what to do for it. Unlike all the other exams that you'll sit at medical school, there's no real textbook, no syllabus, no people in the year above to, well, I guess this year there are people in the year above who've done this exam, but not really many people to give you much advice. So I felt pretty underprepared, and I guess we were told this is an exam of your innate character and how well you match up to the image of this ideal FY1, and I, to be honest, didn't really have much faith in my innate character, and so I didn't really feel comfortable. So I decided to put in some hard work and prepare and do, well, some reading and finding out a bit about the exam, and it worked well for me. I managed to pass and do alright, and I'm working here in South Thames, which is alright. Just as a disclaimer, everything on here is advice and tips and from personal experience. I want to try and give like an honest opinion of what the exam was like and what I found worked well for me and what didn't work, and answer any questions. So nothing here is fact, so you don't quote me on anything, but I hope something from it is useful and you're able to take something away. So, like I said, I'm a big believer in working hard for exams like this where there's not really much information and preparing well. I mean, even now, even yesterday, I heard some F1s and some people were saying, oh, it's potluck, and the best thing you can do is go out the night before and get really drunk, and that's the best way to prepare for this exam. And I guess people are entitled to their opinion, but I think that's probably the wrong opinion. I think even if you haven't really done much philosophy or medical ethics, but if you work hard and if you prepare well, you're likely to do better than the person who's quite smart, done all right through medical school, and just sort of rides along and coasts it and tries to just wing the exam. So I really think there is something to be said about working hard for this SJT exam, despite what some people might tell you. And even if you go on the FPAS website and have a read of what people actually say who wrote the exam, and they say it is possible to prepare for the exam. At no point do they say it's something which you can't really do anything to improve your chances for. They give you their vague little statements like being familiar with good medical practice and having knowledge and insight into the job of FY1. So hopefully what I want to do is try and turn that into something more tangible for you to get stuck into over the next 3 weeks and do something to make a difference to your score in December. So, as I'm sure you're all aware, the SJT exam is pretty important. It counts as half of your FPAS score. So although in the long run, when you're all consultants or GPs or whatever, it doesn't really matter. In terms of where you go for your next 2 years, it's pretty critical. And I suppose that's a good thing. So even after your 5 or 6 years here at medical school, there's still 50% of the marks up for grabs, and it's still really to play for. So it doesn't really matter how well you've done until now. Technically, you'll be able to score, well, your scores will be ranked from 0% to 50%. But as you can see from this graph, everyone's scores sort of sit in the mid-30s to the high 40s, and everyone sort of tends to be around there. But if you think about it, When you look at your educational performance measure, the person who's come bottom of the class and hasn't really done much extra work will score a 34, and the person at the top will score a 50. So in your SJT you tend to score between 34 and 50, your EPM you tend to score between 34 and 50, so both aspects tend to carry equal sort of weighting. And just to mention, technically it is possible that if you do so badly in the SJT, and if you're deemed to have really bad morals or whatever, it's possible to just fail outright and be pulled out of the program. And last year that happened to 12 people in the country. So I guess that's not that big a number, but it's important to bear in mind, I guess. So yeah, I mean, if there's something you can do, if you can work hard and if you can change the outcome and improve your score for it, then you should go for it. It's true what everyone says, that F1s tend to enjoy their foundation years wherever they go, but if you can do something to get a job in a place that you want to, doing a job that you want to, then definitely go for it. Right, so what I want to try and cover today is not the theory behind the SJT, it's not what the GMC booklets and good medical practice actually says, but first I want to look at the background of the SJT. The idea being, if you know who wrote it, and if you know sort of the background and where it came from, you'll be able to figure out where best to go in terms of getting your information and getting your knowledge. Then the structure of the exam, so that's how it's made up of, and how many questions there are, and whether it's important to divide your time up appropriately and look at the clock. Then I want to give you some personal tips and advice from myself and from lots of my colleagues who I've spoken to over the last couple of weeks, and lots of people who went to King's as well. So what they feel worked really well for them, and also what they felt didn't work well for them. Then we'll have a look at the material, so what else is out there in terms of question books, courses, reading resources and stuff like that. And then just sort of an idea of what all things you can be doing over the next couple of weeks to try and give you a step up in your exam. Right, so first the structure. The SJT is made up of 70 questions, of which 10 of them are pilot questions, which means they don't count for anything, but unfortunately you won't know which questions they are, so you have to treat them more equally. Of the ones that count, 40 of them are the ones where you have to rank 5 different options, and they count for 800 marks. And then you have the ones where you have to pick 3 options out of 8, and they count for 240 marks. So essentially, 60 questions that count, and each one sort of having equal weight, equal marks assigned to it. So in terms of timing, that's 2 hours 20 minutes for the exam, 70 questions, that comes out to 2 minutes per question. And our first bit of advice is that actually goes really, really fast. And I remember personally, when I was doing the practice questions, I felt alright time-wise. I was doing them and sort of doing like a practice, couple of dozen or so, and finishing with a good amount of time to spare. So when I went into the exam, I told myself, take your time, make sure you read the question thoroughly, work through it all properly, and just go through it really systematically. And unfortunately, about 20 minutes into the exam, I'd only done the first 2 or 3, and I found out that I really had to step it up if I wanted to finish. And if you think about it, that 2 minutes isn't really that long. If you think you've got to read a whole paragraph and understand what it says, and in these SJT questions, every word counts, and so like in terms of what time of day it is, in terms of who's around, in terms of where you are, in terms of how urgent something is, in terms of how sick the patient is, you have to get a feel from that, from just one paragraph. You have to understand all of that within the 2 minutes. Then you have to figure out what principles they're trying to test. Then you have to figure out which of these options are answering those principles most appropriately. Then you have to rank them, then you have to copy it over, and before you know it, you're well over your 2 minutes. So it does go really, really quickly, and that's not really like how I count the practice questions. But some people say, surely it doesn't matter. What you should do is put your head down, work through the questions well, and you get as far as you get. But unfortunately, that's not really how it works out in terms of the marking of it afterwards. So it does matter whether you finish or not, and that's because of this thing called the low coefficients of variance. And all this information came from a paper in the student BMJ looking at the analysis after the SJT exam. And the big thing that it found was there's something called a low coefficients of variance, which essentially means, as you can see in this graph, all the marks are sort of clumped together in this 35 to 45 range. And if you look at it, in the 40% area, there's about 12% of people, so that's around 1,000 people who scored between 40 and 41. And then, I mean, between 40 and 43, you've got around 3,000 people right there. So a small difference in terms of your numerical mark actually translates into a huge difference in terms of your rank. I mean, if you drop 3 marks, you drop like 2,000 places, which is pretty big in terms of if you think that the whole thing is a competitive process. And to put that into context, the paper found that missing out 1 question, so getting 0 out of 20 by not answering that question, you've immediately dropped 2 points off your FPAS score. And so that's pretty much equivalent of a 2-2 would be a C. And for a lot of people, that would be the same as getting into one deanery versus another, getting into one hospital versus another. So it makes a lot of difference. And again, that's because if you think about it, if you miss out a question which someone else answers, you straight away lost 20 marks. If you give it a go, and the minimum you can get is 8, say it's a rank 5 question, the minimum you get is 8, and the maximum you get is 20. If you guess, I don't know if you guess, but if you give it a good go, you'll probably get around 14, 12, 14. And that's easily 12, 14 marks that you wouldn't have got if you give it a go. The flip side of that is you can't just go through the paper and then what you have left just guess, because clever people at SJT have made an algorithm which is supposed to be able to catch you out if you're guessing. I mean, if you put really stupid answers that don't really make sense, that no one would ever think, then it'll score you 0. So my tip would be pace yourself well and try and get through the paper if you can, more than you would do, say, for other exams. So then, if we have a look at how the paper was written, the paper was made by these people at the Improving Selection to the Foundation Program panel, and essentially that's a group of doctors and professors who got together to figure out what F1s actually do. And they are an expert panel made up of no F1s, and what they did was they performed a literature search, which was going on to PubMed essentially and typing in F1 and finding out what F1s actually do on a day-to-day basis. Then they interviewed doctors, and of the 50 or so doctors that they interviewed, 6 of them were F1s, and they performed around 3 or 4 days of shadowing. And from that they made a 127-page document, which is on the internet, and that basically outlines what all they did and the core duties of an F1. And they made lots of fancy charts which look like things like this. So you've got things like working with colleagues, teaching and training, good clinical care, which is what you end up doing as an F1. And essentially they've put it all together into nice little tables. So if you've got time, it's definitely worth a read, because it goes through systematically what the people who are writing your questions feel is the job of an F1. So leave alone what F1s actually do. I mean, it's obviously important to know that, but for the sake of the paper, it's important to know what the people writing your questions think an F1 does, because it's important to be all singing from the same hymn sheet. And on this paper, they've also got lots of little example scenarios for each point. So straight away there you've got 15 different scenarios, which could possibly turn into 15 different questions. So that's worth a read. And next, this is another tip which I found useful. So when I was going through questions, I found it really hard to keep my own opinions and subjective experiences out of the equation. So say, for example, if you're reading a question about a handover after an on-call, I immediately would read and think, oh yeah, I remember when I was in Worthing, there was this one time when I went to an handover and then this person did this, and then we were told that we had to look after the patient because they were really sick, and so it's always important to do this. And I immediately contaminated what the question said with my own experiences and with my own personal opinions of what I thought was important. And what you've got to remember is these questions, like we just said, are written by doctors and professors who are thinking of the ideal F1 in this scenario. So essentially they're taking emotions and personal opinions out of the equation. And the way I figured out a way of trying to do that was I pictured someone else going into that on-call room, going into all the scenarios that you go to. When I was at Worthing doing my first rotation, I was attached to an F1 called Dr. Duke, who was a really, really good doctor. He was a little bit boring, but he was really logical, and he really went through everything very systematically, and I thought he was a great person to be shadowing, because he would always talk you through this thought process behind each decision, even rewriting a drug. Is that right? Yeah. Even when it came to things like rewriting a drug chart, he would go through it really systematically and explain to me what his thought processes were, and go through it almost like a robot, which in some ways was really good, particularly for the SJT exam. And so I found that if I thought So if I just thought of how Dr. Duke would approach all these scenarios, I was able to take out my own opinions and my own subjective bias and really think of it from the same perspective as an examiner or the person who wrote the question was also looking at this question. So I found that something that worked for me. If you're having those same problems, then you can give it a go. If not, then you can just forget about that. Yeah? Hello? Yeah. Okay, this is a tip which my friend told me afterwards, which was great. But he said that it worked really well for him. And the issue here is, when you come to your paper on December the 6th, you will have done dozens and dozens, if not hundreds, of different scenarios. And if you think about it, there are only really 6 core principles for an F1. There are only 6 things that we do as an F1. And so you'll have probably seen a scenario on pretty much every possible topic. And the annoying thing with that is, as soon as you read a question about a drug doctor, you're like, oh great, this is a drug doctor question. I remember in the question book that I did, it said that the most important thing is to escalate it to the consultant, then you've got to do this, then you've got to report patient safety next, then you've got to do this. And immediately you start thinking this question is like that question. But what I said before is every word in these scenarios is really important. So there might be a subtle difference, like you might be all alone on the ward with this drug doctor. It might be midnight and it might be an emergency with this patient. It might be there's no consultant around. It might be that the consultant's only a little bit drunk. But there are all these little tiny things which you would miss if you were skim reading and thinking you know the scenario already because you've done one similar. So it's really important to understand that you've not seen the scenario before and the examiner hasn't seen the question that you're thinking of before and hasn't based this on that. Each question is unique, and so you should read it and take it for what it is. And so what my friend did was he stopped looking at practice questions a couple of days before the exam and made a conscious effort to not think of previous questions and take each of the 70 questions on the day as they come. It's the second year of this exam and they're probably not going to recycle that many of these questions, so you haven't seen these questions before and so don't think you have. Next, this is my point dedicated to Richard Phillips, and that's to get stuck in and spend as much time as you can do on the wards. And that's because if you think about it, all these scenarios and all these questions that you're being asked about are about the F1 job. And so those of you, especially on medicine and surgery, you're in the ideal place to find out about ward rounds, about the daily jobs, about the boring ones, about the exciting ones, and about the teaching that F1s get, and how you interact with colleagues, and how you interact with like RC nurses and radiographers, and how you do on-calls and handovers. And all of that is stuff that you do actually do on a daily basis. And the only way to really understand the importance or what's involved in all of these procedures is to go in to the hospital and actually do it. I mean, if you don't know what your specialty trainee is when the question talks about it, you're not going to understand the importance, or you're not going to understand when to escalate issues to that level. You're not going to understand if something goes wrong at handover, or how important that actually is. I mean, if these words are just words to you, then you're not going to understand what the examiner is trying to get at. So you really should try and go in and shadow the F1 and find out what they're doing as much as possible. And the other advantage of that is you're following, or you're attached to people who these questions are about. So all these questions are designed from the point of view of an F1. And all these daily jobs which you're trying to learn in your first 2 months back after your elective, these F1s have been doing day in, day out for, I mean 3 months is not that long, but still it's enough to make these things second nature. And they're really valuable in terms of the information that they can provide. And so don't be ashamed of asking them every little question that you might be considering. So if you're not sure why any decision was made, if you want to ask a what-if question, just go for it and ask them. And if they're rude and say they don't want to answer it, then they're probably not the right F1 that you want to be getting advice from anyway. So just keep at it and really just try and get as much information as you can from them. And the third advantage of getting involved in the wards is you're all currently medical students, and in this exam, in 3 weeks' time, you're going to be asked questions to look at them from the point of view of an F1, which is actually a huge jump, and it's not something that anyone I know, I mean, I personally you can't make the jump from a medical student to being an F1 until you're thrown in there, but you're still going to be asked to think like an F1. And I mean, if a patient that you're clerking at the moment were to go off or start vomiting blood or something, you would immediately just think, okay, I need to go and get someone else and run out of that room. But from the eyes in F1, there are things that you can be doing already. I mean, you wouldn't be expected to run out the room, you'd be expected to start treating that patient to the best of your ability. And so knowing when to escalate problems, when to treat, and what to do as an F1 is something you can only really learn from shadowing an F1 or talking to an F1. It's not something you as a medical student will be able to learn from the book. So that's 3 different reasons why you should go. And so there's, the questions are going to be all about what an F1 does. The second is F1s will be able to answer all your questions about SJT scenarios that you see. And the third thing is you need to be able to think like an F1, so the best way to do that is to get stuck in. Okay, so the next thing that we're going to look at is what's out there in terms of material. So what all can you be using over the next 3 weeks to improve your own chances? So the list that I thought of was, there were the official questions on the website, which are on the FPAS website, and then there are the resources to read, so that's things like the GMC booklets and all that official information. Then there are the question books, which I think there were 1 or 2 back in my day, and now there are probably quite a few. And then there are courses and teaching opportunities, so like courses that you can pay for and some free ones that you can go to. And then there's small group teaching, which I'll touch on in a minute. So let's go through these all one at a time. So the first one is the official questions on the SJT website. I mean, if you haven't had a look at them already, I think they're probably a good place for you to start. They're definitely the best things out there. I mean, they're written by the people who are going to be writing your exam in a couple of weeks' time, and they're on the same level, pitched to the same level, and the same sort of style, and they're by far the best thing that you've got. But the only downside is there's a limited bank, so after a couple of days of having a look at them, you're done and you sort of know them. But I think that's definitely the best place to start. And the advice that I would give from in regards to these questions is don't worry about getting the actual answer. Like, if you're going through and scoring yourself, don't worry about if you get the actual letters in the correct order, because that's not the most important thing to take away from this. I mean, these are written by the authors of your exam, and so the most important thing to do is to try and get in that mindset of the examiners. And the best way to do that is if you try and understand the rationale behind the way that the examiners reach their answers. So at the end of each of the questions there's a blurb, which is almost half a page worth, of what key principles the examiner was thinking of, what they were trying to ask you to think of. And if you can do that, then you're already there. In terms of getting to the actual answers, that'll come with time. And I think now, with 3 weeks ahead of you, before you have to sit the exam, you should take your time when you look at these questions and take a pen and paper and write down what core principles they're trying to get at, what the key words in the questions are, what the key words in the answers are, what they're trying to ask you to do. And if you can understand that, then that's the main thing. I mean, if you've got an example from the website. So this is a question about a blood test and a CT that was ordered for a sick patient, and then you've gone home and you've forgotten you didn't check it, and you can't get hold of the F1 who's on call. And there are 5 various options there for you to look at. And so if you take your pen and your paper and you highlight what you think is important in the question. So when I had a look at this, I thought the first thing to take from it is the patient's ill, he's faint and he's confused, she's faint and she's confused. And if you don't do anything, the treatment may be delayed. So straight away you've got patient safety right there. And even if you don't understand how serious faint and confused or treatment being delayed is, it says you need to review, and that's it, that's the end of the question. It's not something which you can really forget about. It says you need to review it, and that's not up for debate. The next thing is, I thought was handover. I mean, it says here you can either hand over to the nursing staff, you can hand over to the on-call specialist trainee, or you can hand over to an F1 on another ward. So there are 3 different options, all of which are not ideal. Well, I guess some are more ideal than others. And then the third issue here is work-life balance. If you've gone home, you don't really want to be coming back into the hospital in the evening to do something which you've got. So if you look at that, and if you spend some time working through it and working through what you think is important, and then have a look at the blurb at the end, you can try and match up how many of the key principles you've picked up. So if you look at what the examiner says, straight away it says patient safety, patient safety and putting the patient at risk. So if you got that, you pick that up. And then it's about reliable handover and responsibility. So if you match up what you think is important in that question with what the examiner thinks is important in that question, you're already on the same wavelength, and that's going to make the whole thing a lot easier. And in terms of getting the B, A, B, C, E, that'll come with time, and that'll come with practice once you do a couple of these, more and more of these. The next is the reading resources. So this is all the things available on the GMC website, on the FPATS website, on that ISFP document up there, all the things that outline the principles that an F1 does. I mean, obviously, you can learn the same things by going into the wards, in which obviously you're encouraged to do, but in the evenings or whenever, if you want to try and put that into text or see it from a different point of view, you can have a read of these books. I think if you haven't had a look at the Good Medical Practice booklet, then that's definitely a good place, well, something that you should be doing over the next couple of weeks. And again, the important thing here, though, is not to try and blitz through these books as fast as possible and try and read them all at once. And I mean, the test isn't going to be a memory test, so it's not going to be about learning, good clinical care, teaching and training, and learning all 6 core principles and being able to recite them. It's going to be applying what you read in these booklets to clinical situations. So if it says good clinical care, you've got to think, what are the scenarios that someone could come up with that implement this principle? So I think, again, if you take a pen and if you've got these books, or if you print out PDFs, or have a look on the internet, and just think of what different clinical scenarios can come from each principle, you'll be able to generate your own scenarios, and most likely you'll be able to generate the scenario that the examiner would generate. And so if you use these books in a clinical way and apply the information in a way that can be applied to your exam, then that's obviously a lot better than if you were to just simply read these books and go, oh, safeguarding is important, okay, end of life care, okay, fine, and go through it in a bullet point sort of fashion. So take your time again with these books and discuss it with other people if you want to, discuss it with doctors if you can get hold of one, discuss it with each other, because there could be a lot of things that you're missing in these books that other people could flag up as being quite important. Next are the question books. I think we had 2 of them available. I'm sure there are probably loads more available if you were to Google it, but the question is, are they actually any good, or are they actually useful? And I suppose the thing is, the official questions, you've only got around, I think, 50 or 40 of them, and you'll be done with those in a couple of days. And again, this is an exam which you've never really sat before. I mean, I'd never really done rank 5 questions where you have to rank 5 different options, or questions where you have to pick 3 out of 8. And so any book which gives you the opportunity to practice that is always good for your technique, and in terms of being familiar with what a paper, an SJT paper looks like. And so if you've already looked at those questions on the FPATS website and you're looking for more practice, then I guess the books are a reasonable, logical next place to go to. And there are loads of questions in these books, but I think the thing to bear in mind is that these books are written by doctors and consultants and GPs in their free time. So it's not an official panel who are being paid to come up with questions. These are people who come home from work and think, oh, if I can bang out another 10 questions a day, then after 25 days I'll have a book I can sell. And these books aren't written by the authors. As far as I've checked, there isn't any of the official panel who made iPhone apps or books for you to use. So I think these are what you've got. And I think the biggest downside of these books, though, is that a lot of them, you can almost tell that they haven't put in as much effort as an actual exam. I mean, if you look at a question here, this one's about you walk into the mess and your colleague who's working currently is taking a gulp of whiskey. And straight away, if you skim through the options, option B says, as your colleague does not appear to be drunk, let the matter drop for the time being. And straight away, even if you're a 10-year-old kid, you'll know that's not a sensible thing to be doing. So straight away, you'll be able to put that to the bottom. And C again is, as your colleague does not appear drunk, let the matter drop, let him know. Whatever. And straight away that goes straight to the bottom. So after 10 seconds, you've immediately found 2 and put them right to the bottom, and you've got 3 left to deal with. And that's not what the SJT exam was like. I thought personally, and from what other people said as well, all the options were pretty realistic. There were no straight away perfect option, no bad option. All 5 you could probably argue a case for. And I think that's probably the reason why I found myself really pushed for time. When I was doing questions like these, you were able to finish that within a minute and a half. Whereas if you're doing a question where you have to weigh up all 5 seriously, that's going to take you a lot longer than if you're only weighing up 3. So I guess my advice would be, do the questions if you've got the time, and if you have access to the questions, and if you finish all the good ones on the website. But bear in mind that these questions aren't really going to reflect the questions that you're going to get in the exam, because the people who've written this are in no way linked to the people who are writing your actual exam. So go for it with a pinch of salt. Okay, next are the courses that are available, and there are some which are free, like this one, and I think they're the King's. There's another King's one, which is small group teaching, which I heard really good things about last year. And then there are some really expensive ones. I mean, I got an email asking if I wanted to sign up for ACE Medicine SJT course a couple of weeks ago, and I'm not really sure what that one's like, but I think the same principle rings true here, in the sense that these courses are being run by GP trainees, junior doctors, or even consultants who have never really sat this exam before and don't really know what the exam is like. They're pretty much going off the ISFP core principles and what the practice paper is like on the internet, and that's really all they've got to go off. And then they're going to make a whole day course based upon just that information. So again, they're just extrapolating from their own opinion what they think that the core material is for this exam. They don't know, and they're not going to give you a big secret when you get there. I mean, there's no secret for this whole exam. And so you can't really go to these things to expect to find a secret answer. I think the good thing about these courses is essentially you're trapped there for 12 hours thinking about SJT stuff. You'll be talking about core principles, you'll be talking about what's important when you look at questions, and you'll be learning a lot of new things which, I mean, you wouldn't have been able to pick up if you were sat in your room by yourself doing these questions. So there's something to be said about courses, but I think again it's important to remember you're not going to be getting a secret from these courses, you're not going to be getting any special answer. What you're going to be getting is the information that you have access to, paraphrased in a different way, which might be better for you, and questions that these people have made up, again, simply using the practice paper as their basis. So if you haven't done any, have a think about that, and if you think something like that would be useful, spending a day talking about questions would be useful, and go for it. Otherwise, there could be other options, like small group sessions, which I think is really the best way to prepare for something like this. And I think King's did one where you sit around in small groups and talk about ethical scenarios, but especially for those of you in DGHs or in GP groups, you've already got groups of 5 or 6 of you in a room together, or if you have that many friends, then you can all get together in a room and have a think about some questions that you found that you thought were difficult, some issues that you thought could be relevant to the SJT. I mean, I don't know what it says about me, but I personally, before I started revising, I thought that my opinion was usually going to be the right opinion. But when you get in a room with 6 or 7 other people who've had completely different experiences during their university life, and you approach a question about one topic, I mean, then you'll realise that there are 6 different people with 6 maybe completely different opinions that you wouldn't have even thought of. And no matter how many practice questions you do, you'll never be able to get the insight that someone else has when they come and look at that question by doing 100 questions. So I think what's really valuable is you're looking at, by 2 people looking at the same question, you're getting 2 points of view that you probably might not have ever come up with. So if you can get 5 or 6 of you together to discuss, to come up with an opinion, to challenge other people's opinions if you disagree with them, and talk about it, you'll essentially be exponentially increasing the amount of information and experience you have, which is really valuable when you think that these examiners have got something in mind that they want to try and get you to understand, and all you have is your 5-6 years of experience as a medical student, or I guess 3 years if you count your clinical years. And so by talking to other people, you're doubling and tripling and quadrupling your experiences and your opinions straight away. So it's really useful, it's free, and it isn't something that you have to do formally. You can do it over dinner or whatever, but I mean, if you spend a little bit of time every week or so just talking about some of the things that you don't really understand, or talking about a scenario that you can think of, then I personally found that really, really valuable, and I can remember thinking of dozens of experiences, dozens of times when I thought of something for a question and someone came up with something completely different I was sure was going to be wrong, but then when you answered it, you found the other person was right. And then you're like, why did you think that? And you pick up lots of useful information through that way. Next is, I guess, what all things you can be doing now. This is almost a little bit of a summary in terms of what we've just said. So the first thing is, if you're not already, keep going to your clinical placements. Make the most of that. don't at all feel like you can't, don't at all feel ashamed of asking anything or doing anything or shadowing someone, even if you think that they won't want you. Just really just think you've got 3 weeks left, and this exam is going to count for a lot and influence where you're going to go for the next 2 years, what you're going to do, and potentially that could have knock-on consequences. So, bold, like unashamedly, just go for it and just get stuck in as much as you can. Next is try and arrange some small group sessions. If it doesn't work, it doesn't work, and you can go back to practicing by yourself. But if it does work, then it's really valuable, and it's something which isn't really as pressurized as revising in the traditional sense, so it can be fun as well, I guess. The third is, if you haven't already, have a look at the online questions. Even if you have just done the paper and then just marked yourself on it, go back and have a look at the blurbs and make sure you completely understand what the examiner is talking about when he asks every question, and make sure you understand their point of view, because that's the most important thing, and that mindset is the mindset that's going to be writing your exam. So it's useful to try and get into that frame of mind as early as possible. Fourth is the reading resources. So these are the little booklets that are available on the website that we talked about, and again, you can either print them off or have a look at the PDFs online. And I think on the GMC website there are also some online scenarios where you can be the doctor going into different situations where they'll ask you ethical questions which are similar to SJT but almost a bit more dragged out. They're pretty useful again, so make sure you have a quick look through these GMC websites. Again, it's not something which will take too long, and if you think about how important this exam is, giving it a couple of hours of reading, a couple of hours of revision is not asking for that much. And fifth is, my advice would be, take it seriously, don't go out the night before, try and spend a bit of time practicing for it, revising for it, doing the right things for it, because you won't realise it now, but the little things that you do now will actually pay off quite a lot in your exam, and give it the time that it deserves, and hopefully you'll all do great. So I guess the last thing I'd say is good luck, and I hope you all do great in December. I'll answer any questions, and I'd like to say a big thank you to Lucy and MSA for helping put this whole thing on, and yeah, if you can fill out the feedback forms and give any feedback you can do, that would be great as well. Can't hear what you're saying. King's Run.
Running courses in January.
Oh yeah, so yeah, that's another point that I forgot to mention. So when we all came back in January for our next campus block, King's will put on this really good small group teaching where you're in small groups with consultants and doctors and everything, where you'll go through you have a booklet of about 50 different ethical scenarios asking you questions about what you would do in this situation, what you would do in that situation. I remember everyone just sitting there thinking, why have you put this on in January when we start our exam in December? And then they'll give you to take away, 50 great scenarios. I think I still have a handout of that somewhere. I don't know if it's on the virtual campus already. I'll try and dig that up. Yeah, if I find it, I'll send it to MSA. If not, I'm sure Richard, I mean, if you have a look at your campus block timetable for January, it might be in there. But there's a list of like 55 scenarios, which are a good place to start in terms of your small group teaching, which you can do. So yeah, good point.
Did you get any feedback on your colleagues from which of those 3 books they thought might be even ever so slightly similar to what you can expect from them?
So I don't think this Get Ahead one was published by the time we were doing it, so we were really using these other 2. And I think most people only had a chance to do one or the other. And so there was no real direct comparison. I used the white one, and I quite like that. I don't know why, but I think it was quite systematic and quite neat. Whereas the other one, I mean, I think that question is from there. I mean, it doesn't look as professional. I don't know who wrote it, but I think if you just think that these question booklets are just for your practice, the real answer is I'm not sure which one's better than the other, but I used the white one. I don't know if that counts. My email address is on the front if you have any other questions. Otherwise, I'm sure there are better people who can be asking the questions or other F1s that you're all shadowing. Perhaps I'm not going to